Hello, my name is Jerrod Blount, and this will be my presentation on a comprehensive overview of meningitis. Meningitis is a serious condition characterized by inflammation of the meninges, which is the thin membrane surrounding the brain and spinal cord. As we see in Figure 1, the meninges are divided into three separate layers. The most superior layer is called the dura mater. Beneath this is the arachnoid layer, and below all of these is the most inferior layer. This is called the pia mater. There are several different forms of meningitis. The most common of these are bacterial and viral meningitis, which will be the primary focus of this presentation. Rarely, a person can be diagnosed with parasitic or fungal meningitis. Non-infectious causes of the disease are also uncommon, but may be caused by conditions including chronic inflammatory diseases such as sarcoidosis. Certain types of cancer, such as melanoma, can also cause meningitis as well. This is referred to as carcinomatous meningitis. Signs and symptoms of this condition may commonly include seizures, a stiff neck, confusion, pyrexia, which is a medical term for fever, cephalgia, meaning headache, photophobia, which is the sensitivity to light, and anorexia. This term is widely mistaken for anorexia nervosa by the general public, but in medical terms, this means a loss or a lack of appetite. Nausea and emesis, which is the feeling that one may vomit or vomiting, respectively. Fatigue is the condition that is often an exhausting experience. And a hemorrhagic rash. Hemo refers to blood. So a hemorrhagic rash has the appearance of many small clusters of tiny purple blood spots on the skin. These will eventually grow to form large areas of discoloration, which are similar in appearance to a contusion or a bruise. Viral infections are the most common cause of meningitis. Viral meningitis, also referred to as aseptic meningitis, is most often caused by enteroviruses in the United States. This group of viruses includes such diseases as the herpes simplex virus, HSV, hand, foot, and mouth disease, HFMD, measles, mumps, the human immunodeficiency virus, HIV, and influenza, among others. Now, viral meningitis is generally less severe than bacterial meningitis, and the majority of patients recover without the need for any advanced medical treatment beyond supportive care. Those most at risk for developing a severe infection include children under the age of 5, anyone undergoing surgical procedures, those with weakened immune systems, such as those with HIV or patients receiving chemotherapy, which is a chemical treatment. Now, according to data provided by Dr. David Bamberger of the Kansas City School of Medicine, this condition causes around 219 cases per 100,000 infants each year. 27.8 cases per 100,000 children under the age of 14, and 7.6 cases per every 100,000 adults every year. As you can see, this disease is much more common among children when compared to the adult population. Meningitis can often be deadly and debilitating for affected individuals. While there are several different bacteria that can cause meningitis, the two most common forms are referred to as pneumococcus and meningococcus. Now, pneumococcus is caused by the bacterium Streptococcus pneumoniae, and the bacterium Neisseria meningitalis causes meningococcus. Now, pneumococcus is responsible for around 6,000 cases reported each year, making it the most common form of bacterial meningitis, with the greatest chance of being fatal as well. Now, in addition to the typical symptoms of meningitis, this bacterium can cause pneumonia, septicemia, ear, and sinus infections. Septicemia means blood poisoning, and I will go into more detail on this dangerous condition shortly. There are 2,600 cases of meningococcus each year. This bacterium is highly contagious, and it puts those who live in close quarters, such as in college dormitories or military-style barracks, at a greater risk of infection. As with viral meningitis, those with suppressed immune systems and infants are at a greater risk. Again, using data provided by Dr. Bamberger, we see that overall, bacterial meningitis causes about 1.5 cases per every 100,000 persons each year in the United States. Unfortunately, the mortality rate is about 15%, and between 10 and 20% of patients who survive this disease are left with some form of brain damage or amputated limbs. This is often a result of complications caused by septicemia. Treatment for viral meningitis typically includes supportive care, such as bed rest, increased fluid intake, and over-the-counter medications to reduce fever. While viral meningitis may be less severe than bacterial meningitis, it can still require more advanced treatments beyond simply supportive care. In these cases, antivirals such as acyclovir may be used. Now, the treatment for bacterial meningitis needs to be initiated as soon as possible. This includes intravenous or IV antibiotics that are injected directly into the patient. Broad-spectrum antibiotics are also typically used in the early treatment of the disease. As the name suggests, these antibiotics are effective against a wide variety of bacteria. This increases the odds of successful treatment and hopefully prevents septicemia from occurring. Corticosteroids, such as prednisone, may also be administered to help reduce inflammation around the brain. Anticonvulsants, such as phenytoin, may also be administered to help prevent seizures. Pain medications and sedatives may also be required to help the patient feel more comfortable, especially if septicemia develops and surgeries to remove the infected or necrotic, meaning dying, tissues are required. Septicemia, which is the clinical term for blood poisoning, can occur when a bacteria that causes meningitis enters and multiplies uncontrollably in the bloodstream of the patient. This is most commonly associated with the meningococcal form of the disease. Septicemia can develop with or without infecting the meninges. However, both may be infected at the same time, leading to a double infection. Signs and symptoms of septicemia can include cold extremities, anxiety, anorexia, lethargy, which is a lack of energy, pyrexia, hemorrhagic rash, and hypotension, which refers to low blood pressure. The hemorrhagic rash may appear in the later signs of the infection, beginning with clusters of tiny purple blood spots on the skin, which will grow to form large areas of discoloration, as you can see in Figure 3. There is also a risk that septic shock may develop. This can lead to dangerous hypotension which in turn causes further complications that can increase the mortality rate of those affected to nearly 50%. The treatment for septicemia usually requires the aggressive use of IV antibiotics and fluids. Corticosteroids will also be given to decrease inflammation. Oxygen may be provided to the patient to assist with breathing. Vasopressors can also be given to increase a patient's blood pressure, which will help prevent complications that hypotension may cause. Additionally, the patient may be placed on mechanical ventilation or dialysis in the event that there is severe damage to the respiratory or urinary systems. Surgery may also be needed. Draining abscesses is a surgery that is likely to be required for the patient. An abscess is a collection of pus within the tissue. This can either be done by making an incision, which is a surgical cut along the skin, which will allow the pus to drain from a surface abscess. This can also be performed for abscesses that are below the skin by inserting a small needle through the skin in a procedure called a percutaneous abscess drainage, or PAD. Percutaneous refers to through the skin, meaning that this is useful for removing infected fluid without the need for open surgery. This greatly reduces the chance of spreading the infection. Surgery can unfortunately also involve removing infected or necrotic tissue. This is referred to as a debridement. And amputation of one or more limbs may also be required in severe cases. This condition is diagnosed through both physical examination by a physician and through a variety of diagnostic tests. During the exam, the physician will check for signs of infection around the ears, throat, head, and along the spinal cord. He will also likely perform neurological tests. These are designed to assess mental status, nerve function, balance, vision, hearing, and speech. Diagnostic tests will also likely be ordered to help to confirm the presence of the disease beyond what can be determined by physical examination alone. A computerized tomography scan, or a CT scan, is one such test. It is often used with a contrast dye to clearly show signs of inflammation of the meninges. It can also be useful in checking for signs of encephalitis, which is the inflammation of the brain itself, detecting abscesses around the spinal cord, or detecting internal hemorrhages. Electroencephalography, or a EEG, is a test that is useful in identifying abnormal brain waves. This can help physicians to diagnose seizures and can even help to suggest certain viral infections, depending on the specific electrical activity that is detected. Another test is called magnetic resonance imaging, or an MRI. MRIs produce a more detailed image than what a CT scan can provide. This is due to the fact that radio waves and a strong magnet are used to produce images of the brain tissue instead of using radiation, resulting in a clearer image. The MRI can help to identify inflammation on the brain and spinal cord, or it can be used to help detect infection. As with CT scans, a contrast dye may be injected prior to the MRI to help produce more detailed images. Additional screenings may involve cultures of blood, urine, or other bodily fluids. These cultures may be taken and placed into a culture medium to allow potential bacteria to grow. Samples may also be placed onto a slide and stained with what is referred to as a gram stain in order to study the sample under a microscope. These screenings will help rule out metabolic conditions or to confirm the presence of antibodies or foreign proteins within the sample. A more invasive test may also be ordered. This is called a lumbar puncture or spinal tap. This would be ordered to provide a definitive diagnosis of meningitis through analyzing a patient's cerebrospinal fluid, or CSF. As we see in Figure 4, this procedure involves a needle being inserted through the lower back to receive a small amount of cerebrospinal fluid. The CSF can then be analyzed for signs of infection, such as detecting low glucose levels, leukocytosis, meaning an increased white blood cell count, or the presence of bacteria or blood in the fluid. If there is an infection present, the fluid may also have a cloudy appearance. This can be seen in Figure 5. This is quite distinct from the clear appearance that the fluid would typically have in a healthy individual. To briefly recap, those with weaker immune systems are at the greatest risk of infection, including HIV patients, those receiving chemotherapy, and young children. Vaccination is a very important action that a person can take in order to prevent meningitis from occurring in themselves or in their children. While there is no direct vaccine to protect against enteroviruses, which is the most common cause of viral meningitis, vaccines are available that can help in preventing infection by the bacterium that cause both pneumococcus and meningococcus. Some additional preventative measures can include frequent hand washing, avoiding bites from blood-sucking insects such as mosquitoes, as these insects can easily transmit bacteria that cause meningitis and encephalitis. Try to avoid close contact with others who may be infected. Disinfecting handles that are frequently used is also an important habit to protect against a wide variety of illnesses. Also, wash your hands prior to touching your face. This can help prevent spreading a variety of bacteria. Prognosis for infected individuals varies significantly depending on the severity of the infection. However, most patients recover within a few weeks with a prognosis that is generally positive, specifically for those with a viral infection. However, as I previously mentioned, bacterial meningitis survivors have a significantly more difficult outlook, with approximately 15% of cases resulting in the death of the patient. 10 to 20% of survivors are left with some form of either brain damage or amputated limbs, and 14% are left with hearing loss as a result of neurologic sequelae, which basically means that this is a pathological condition resulting from a prior disease. 4% of patients also experience hemiparesis, which is the weakness on one side of the body. Other additional effects of meningitis that survivors may experience include memory loss, lack of coordination, cerebral palsy, or CP, which is a disorder of movement, muscle tone, or posture. Blindness may also occur. Epilepsy, which can cause chronic seizures. Paralysis, deafness, and speech problems such as aphasia, which is the loss of the ability to express speech, are all also possible conditions that one may experience. Septicemia can leave what is perhaps the most painful reminder of the disease. Many survivors suffer severe scarring, amputations, damage to the urinary and respiratory systems, and arthritis. And unfortunately, many of these experiences can contribute to survivors developing depression as well. In conclusion, I would just like to say that the survivors of this horrifying disease need the support of their communities in order to successfully adapt to their new way of life. Many who are scarred and disfigured stay hidden in their homes out of fear of embarrassment, disability, or because of depression. Mental and physical disabilities can make living a normal life painfully difficult. The public needs to be aware of the importance of proper vaccination in order to protect not only themselves and their children, but also to protect the children who are unable to receive the vaccinations due to weakened immune systems or other health complications. Additional research must be undertaken because every parent and child deserves to live in a world without the fear of contracting such a devastating disease. Thank you. I will now conclude my presentation on my reference slides.